Hi, this is Sharon Birch, Director of New Directions for Nurses and LiberatedNurse.com. We teach nurse coaches, consultants, and educators how to grow thriving businesses. Welcome to the Respectful Marketing Tips for Caring Nurse Entrepreneurs event. I often hear nurse entrepreneurs say they need more customers, but they feel awkward or uncertain when they make their offers. So I've assembled a panel of successful nurse entrepreneurs to share their experience and tips with you. Today, I'd like to introduce my guests, Lyn McCright and Teresa Walding. I've invited Lyn and Teresa because they've created a successful online education, coaching education program for nurses and other health professionals. Lyn McCright began teaching resilience principles 30 years ago in her private practice in California. Today, she's an internationally known thought leader who speaks about the current transformation in nurse coaching, holistic nursing, and advanced practice nursing. She's the founder and owner of Advancing Nurse Coaching, a business that prepares nurses for nurse coach board certification. And she's a consultant to healthcare organizations. Lyn holds a master's in public health nursing and is an adult and gerontological nurse practitioner and a clinical specialist in community health nursing. She is dual board certified as an advanced holistic nurse and a health and wellness nurse coach. Teresa Walding has been a registered nurse since 1993. And worked in various clinical areas, including ICU, rehab, psychiatric, pediatric, home health, and post-anesthesia recovery. She's been a board certified nurse coach and the associate director of the Advancing Nurse Coaching program since 2016. She's taught the resilience principles paradigm nationally and internationally as a speaker and teacher at conferences, meetings, webinars, podcasts, and retreats. She's the co-leader of the Austin area chapter of the American Holistic Nurses Association and a contributor to the AHNA, that's American Holistic Nursing Association, to the Beginnings magazine, AHNA Beginnings magazine. She's passionate about coaching, mentoring, and teaching the resilience principles paradigm. She established Teresa Walding Consulting, PLLC, in 2019. Welcome, Lyn and Teresa. Welcome to the event.
Thank you so much.
Thank you so much.
We were delighted to have you as our student, and thank you for that as well. We learned a lot from you, Sharon.
Oh, thank you, Lyn. I think that's the best way to be in life, don't you? So we all learn from each other.
Every day.
Every day. So yes, you and I know each other because I was one of your coaching students. I went through your program to get my nurse coaching skills and prepare for this board certification exam. And I also know you through our work with the American Holistic Nurses Association.
We've been really privileged to be chapter leaders for the last 11 years, and it's been a joy to share with nurses nationwide. We've been having lots of members that have come to us from other states, and because we're virtual, we love to invite everyone.
Yes, I think that's important to let people know that you have a chapter that's virtual. So your meetings and your events are online. You often offer CE credit for those.
Yes.
And you welcome any nurses. Isn't that right? They don't have
Yes.
to be a member of AHNA.
Right. They're welcome to join our Facebook page. And if you are a member, you'll be on our email list. You're welcome to join that as well if you are a member.
Great. Well, I know you from those ways, and I'd like to help the audience get to know you too. So let's start out with something fun and easy to answer. Where do you live and what do you like to do for fun?
Well, my home is in the middle of Texas, halfway between Dallas and Austin. I live in Woodway, And my most favorite thing to do is to swim, which is why I have a pool in the backyard and my office overlooks the pool. So I can go from the pool in the morning into my office to go to work. And that's the way I love to start my day.
Oh, I love that. That's great. I love to swim too, Lynn. You and I share that passion.
Yeah, that is one of my favorite things as well. I live in Killeen, Texas, which is about an hour south of Waco. And what I like to do for fun is family gatherings. I love to have my friends and family over and cook and visit and do whatever we do. I like to also take them on little adventures to museums and little tourist things around town and in Texas. So when people come to visit, I like to show them the area and see things they haven't seen before.
Nice. In that background behind you, is that in Texas?
No, this background reminds me of Boise, Idaho, which is where I grew up, and looks like a house that I was in when I was in my 20s, when we used to get to tour some of the homes being made up on the what they call the foothills. And when I saw this picture, I was like, that's me. That's where I want to be there. So I come to this room every day.
That's
And,
great. That's one of the good
it's really
things
fun.
about, yeah,
Yeah,
one of the great things about getting to live in a virtual world part of the time.
yeah, yeah.
Well, I call you successful nurse entrepreneurs because of the wonderful business that you've developed and the far reach that you have with nurses across the US and internationally. And but I know that's just part of what a definition of success is. And I know that we each have our own definition that guides us in the choices we make. And so I'd love to hear how each of you defines success for yourself.
Well, for me, I think it's very simple. It's what feels rewarding to me. And so, right now, in my position as an administrator of a nurse coaching program, I have the opportunity to coach nurses and licensed health professionals any day of the week. And what I have found is that working with the principals, it's not only the simplest thing that I have ever done, but also the most rewarding. And when I coach another nurse, I feel equally as rewarded as the person that I'm coaching.
Hmm,
Both ways every time.
wonderful.
I tend to agree. It's like this is the most fun I've ever had in my life, to watch people wake up and know how special they are and how much they affect other people's lives, and kind of get out of their own way of what they want to create in the world. It's really fun to watch people say, I never thought about life like that before. Or if they're struggling, they're like, I don't even know what to do anymore. And one coaching conversation can change everything. You
Hmm,
know, to be coached yourself is one thing, but to be the coach and watch people transform before your eyes, that's success.
hmm,
That's like the place to be. That's the area where I think um, every nursing skill I have comes alive in
hmm.
that space. And it's just so for me, success is watching people grow through that process and see what they can do.
Yeah.
Wow. Sharon, I'm just realizing we say in nursing that there are two major shortage areas. One is psychiatric nurses that work with mental health, and the other is nursing faculty. But what I'm realizing in this moment is that actually that the largest shortage area is certified nurse coaches.
Yes, because it's a fairly new field and growing very rapidly, but still it's a small number who've actually gone through the training and the practice and the certification. correct?
It's only 9 years old. So we really are living on the leading edge of change in regard to transforming the healthcare system. And it will come. It is coming
It's
already
coming.
through
Yeah.
nursing.
Mhm.
You know, we were talking to a lady when we held our Nightingale moment of silence in May for Nurses Week. And she was talking about the tipping point of anything. And she said it's when 0.001% of the whole is engaged in that change. Well, if nurse coaching, there's almost 4 million nurses in the United States, and 0.001% of that is what, 1,400, I think. There's 14.8 million worldwide. Whatever the tipping point was, we're there. We
Wow.
had 1,008 board certified nurse coaches at last check, and we needed 1,408 to be at the tipping point. And I
Oh,
would be willing to bet that we're there.
wow.
And that means that there's no stopping it. Enough people now know about it that it's here. It's here to stay.
Yeah. I coach and mentor nurses who want to grow thriving businesses. And I would venture to say 5 or 6 out of every 10 have heard of nurse coaching, but they don't really know what it is. They're
Right.
curious. They want to know more. They want to know what's involved, and how would it benefit them. And I wonder if either of you would like to speak to that just a little bit so that the audience can learn more about how it would being a nurse coach could benefit them in their career, and especially in terms of being independent of an employer and going forward on their own.
Well, this is almost backtracking a bit, but to say that there are 2 certifying bodies that certify, accredit really nursing programs. And in their standards, one of those 2 accrediting bodies has used the word nurse coaching in their most recent guidelines. So it may not be exactly certified nurse coaching yet, but at least the word nurse coaching has appeared in accreditation of nursing programs. So that's where we begin with students who are going to be graduating as nurses. And we're finding that all of the nurses who are retiring now, and there are huge numbers, I think the average age of a nurse now is considered to be 55. So within the next 10 years, we'll have a huge number of nurses who are ready to retire. And I just came back from the National Black Nurses Association conference in Chicago. And so many of those nurse educators are interested in continuing their work as nurse coaches. I had the opportunity to speak to over 100 of them individually at the conference, and it was a conference of about 800 who attended.
That's
So
wonderful.
I'm thrilled because it really is, to me, the freedom that will allow us to spread our wings and be our own boss. I actually started that myself in 1986 when I set up my very first private practice in California.
You know, I think when we first started out in nurse coaching, you couldn't find anything like JobWise or advertising. There was nothing. And if you start looking at job offerings now, they're actually saying nurse coach in their job descriptions, you know, hiring. And a lot of it is case management and different things like that. But I know I was on a meeting the other day where they're talking about they're actually hiring nurse coaches in organizations to coach the staff. So there's a lot of work being done on the ground to bring nursing knowledge out to people. You know, we think that nursing knowledge is everyone knows it. You know, as nurses, it's just how it is. And you start talking to other people and they're like, how do you know that? or tell me more, or like the favorite we all get, everyone calls you for advice, or
Yeah.
I have a friend who needs to know, things that are just normal everyday information to us. Nurses have knowledge that the public needs to know.
Mhm.
And we know how to share it. We know how to connect with people. And that's why nurse coaching showcases what nurses can do. I think it gives us a way to let the public know what's different that nurses can assist with in health and wellness.
Wow. What's coming to me now is just that nursing. This is a quote by Florence Nightingale, and she said it in the preface of her book, Notes on Nursing, What It Is and What It Is Not. She said, knowledge of nursing is knowledge that everyone ought to have of how to put a body into a state of health. It becomes more important every day. And here we are. Finally, she told us in 1870 that the kind of nursing that she envisioned would only be seen in 150 years. That year was 2020. Here we are. She saw this, and yet we're only just beginning to put all of pieces of the puzzle together. Basically, what it is that practice goes out in advance of the legal system by about 10 years in every field. And now certified nurse coaching is about to be 10 years old next year.
Mm. Mhm. That's a wonderful point. Oh, it's so inspiring to me to be part of this and to see how much is possible for nurses. And I agree. It's nurse coaching skills can be very valuable for nurses, whether they want to stay as an employee role or whether they want to become have their own business.
Yeah, well, the National Institutes of Health did a study of certified nurse coaches. It came out in the Journal of the American Academy of Nurse Practitioners in May of 2018. And what they found was that 25% of the nurses worked in a hospital setting, 25% of the certified nurse coaches worked in private practice that they owned, and the other 50% worked all across the board wherever nurses are in the community. It could be a birthing center, school nurse, hospice, end of life, anywhere in between.
Mm.
So we're already in the community. 50% of the certified nurse coaches are in the community.
Mm.
And 75% if you want to add the private practice to that.
Yeah. And that's where we need to be, isn't it?
Yes.
We need nurses everywhere. There always will be nurses within a hospital setting, and we want to encourage those nurses as well in being secure in their skills and their work and finding the joy that they came into nursing for in the first place.
Mhm.
That's why resilience is such an important topic.
Yes, I'd really like for you to share a little bit about resilience with us. Because I know that it's the foundation of your approach to nurse coaching and more. So would you tell us a little bit about it?
Oh, thanks, Sharon. Well, I'll just say that in 1986, when I began my first private practice, I actually titled my practice Stress Resolution and Prevention. So my first tip for today is don't name your business stress. It's not beneficial, but we have a much better terminology now, which is resilience. And people can identify with that because we all want to be resilient. And we think that there's a way to find that resilience. What Teresa and I are doing, working within the principles and sharing the principles, is that nurses are naturally resilient. We are born to be resilient. All of our heritage through all of the generations has made us more and more resilient. We're designed this way. And what our job now is allowing nurses to see for themselves where they are naturally resilient and watching that blossom. Teresa?
I was just thinking, you know, when I first found out that there were actually principles that guide human mental life, I'd heard that before a million times, right? I knew that. We instinctively know that we are thinking, feeling creatures, but I had no idea the depth that you could actually know your thoughts creating your life in the moment. And that was actually resilience, because we have the ability to recognize our thinking, to be able to help us navigate life, and that we've been doing it our whole life. But when we put a framework on it, we call it implications, not applications, we begin to point to how it always works that way, even when it doesn't appear to be so. Which means we get to live our life every moment of every day with our thoughts and our feelings that come right out of our eyes. That's the world we see. And knowing that, the very first time I saw that, I was going through a really rough time in my life, with my career, my health, my family. Felt like everything was falling apart. And to realize that I was the one putting all the meaning onto that completely changed my perception and my perspective. And I suddenly was able to settle my thinking down and really see clearly what was happening. And I was making up a lot of stories about things that weren't even happening, but I was worried that they might. And that created a place where my natural resilience emerged and I could see what to do next. That was life changing. And that wasn't a long time. I didn't have to practice it. I just saw it like ever so briefly, and it completely changed everything in my whole world, to the point where I literally knew exactly what to do next, which was take a nurse coaching course. And in 6 months, we began recording the videos for our own course. And as they say, we've never looked back. And that clarity and that ability to do that is available to every single human being. And I feel like this is the shortcut to getting out of our own way to do the things we're here to do.
That's just remarkable. Thank you so much for sharing your own experience like that, Teresa.
Yeah.
And so is this resilience paradigm what you teach nurses in your coaching program?
Oh,
Yeah.
it is. Absolutely. Yeah. We can now teach through logic that which can only be understood through insight. That's new. We are not asking people to memorize anything. We're not asking them to add something more to their plate, something more to do. We're just asking them to have a look at who they are and how they are being. That is where our resources lie, and they're always there. It's the deep well that we all go to for nourishment and refreshment, and we are never without it. In fact, one of our colleagues, a wonderful psychiatrist, Bill Pettit, says, never broken, nothing lacking. That's nurses. We are never broken. We have nothing lacking.
Mm.
We have everything we need. It's inside.
Mm. So profound. And I think we recognize that the truth in that when we hear it. And yet I think that many of us have so much conditioning to the opposite, that we are lacking, that we are broken, that we are wounded, all these different things. And so what I hear you saying is that there is a way that you can teach nurses to see the truth beyond that for themselves and to coach others to also see that. Is that?
There's a lot of rhetoric that is out there that is not helpful. And what we're looking at today is the truth about how human beings work. And that truth is quite literally setting us free. So that we don't have to have a lot on our minds. We, in fact, are, how do you live from the present moment? By quite literally dropping distracting thoughts. And those thoughts will come, but we can also let them go. There was a colleague of ours who worked in a large Midwestern medical center of 400 physicians, and he only worked with about 30% of them. They reduced their burnout rate by 12% institution-wide, even though less than 1% of the docs was in the program.
That's remarkable, really phenomenal.
It's something that is coming into its own, but because it seems so outside the box, because it's not what everyone else is saying, it's like a small voice crying in the wilderness. But we are being heard, and we will be heard more every day, because lives are changing, not just in this country, but worldwide. We're actually part of a global community. And when we opened our school, Advancing Nurse Coaching, we actually opened on 3 continents. We had students in Asia and Europe, and we have students in Canada now. It's such a joy to be able, the issues of nursing are the same worldwide. So we're sharing with all of us. And a new group of nurses from Denmark have recently contacted us as well. They have the same issues we do.
Well, and they've also caught wind of what these principles do for people, and they experience them for themselves, and they're like, we want this for all the nurses in our country. That's their goal, is they want to share these principles of how mental life works, because they've seen something that is incredibly helpful and settles their thinking down so that they can solve the problems of what healthcare is going through right now. I don't see us being able to solve the problems with the old way of thinking. It's not worked. Ever since I've been a nurse, we've been recycling the same solutions, about every 5 to 10 years. The new one comes out as the new generations come out, and they think, well, I think we'll do it this way, it'll work this time, and it doesn't work. We have to have a new way to look at not just nursing, but healthcare. And what does health look like? How do we create health? Doesn't everyone want to know that secret?
Sure.
It starts from within here. It starts with our thoughts of how we work, because it does affect our body.
The physicians that our colleague worked with found that they were able to decrease their ruminative thinking by 64%. And as their minds became more open and more clear, they were able to find the answers to their patients' problems more easily, more directly, which allowed them to leave work on time, to get home to their families, have better work-life balance, and they loved the organization they worked for.
That's really transformative. It's really what we are looking for, is a solution like that. And especially when you say it doesn't give you, learning it doesn't give you a lot to do. It actually brings you to yourself.
Yes.
Simplifies what you're doing.
One of our nurses in Europe said that she suffered for years with what had been diagnosed as rheumatoid arthritis. And when she learned about the principles, all of her symptoms disappeared.
Isn't that remarkable? Well, now, how would you bring the principles to this idea of feeling more comfortable to let people know about our business and make our offers? What would you say about that?
Well, I think that's a good question, Sharon. And what it comes down to is that the Gallup poll every year for the last 19 years has shown nurses to be the most trusted, the most ethical, and the most honest of health professionals. So now is our opportunity to connect with our public directly. And by doing that, what we are putting forth as a certified nurse coach is that we are a nurse first. And we're bringing all of that background, all of that experience, all of that interest into our work as coaches. So as you are secure in being a registered nurse, you can be assured that you are offering huge volumes of what will benefit mankind through coaching. Teresa has something more to say about this.
I see nurses practicing at the top of their license as a nurse coach. We never stop assessing people. When you are coached by a nurse, we are trained to be detectives of every kind. You know, we listen to the words, we listen to what's beyond the words. We ask questions that draw out the information that they don't even know is there. And, you know, one really good example was one of our students, a nurse practitioner in a diabetic clinic, taking care of an 85-year-old elderly lady for her diabetes, who was not taking care of herself. Her blood sugars were out of control. And when she dropped into the conversation, she realized it had nothing to do with her diabetes, had everything to do with the death of 4 family members in the last 3 months.
Oh.
And she was grieving. I mean, any of us would do that. And she had the question came to her in the conversation to ask her, do you want to live? And she said, the lady looked at her like, what do you mean? And she's like, well, I'm here, aren't I? And, you know, but it caused a deeper level of conversation and reflection on the patient's part. And so they could talk about that and what that meant for her blood sugars. And, you know, the desire to live was apparent. And she came back 3 months later with more blood sugar checks than she'd had in 3 years and an A1C that was perfect for her. Well, that's not the way we usually get places, is it?
Yeah.
It's, you know, you need to do this, and, you know, you should be doing this, and step by step. But nurses don't do that. We get to root causes. We allow people to talk about things that aren't related to the diagnosis, and come to find out that's really what's the most important part of health, is realizing how much your own thinking has to do with your health, because it affects your physical body and the world around you. And nurse coaches bring that whole perspective together and allows the patient to see it, to reflect it back to them so they can see the reality of that. And then the behavior naturally follows. There's no effort there. And I think that's one of the ways we bring a different perspective to coaching.
Coaching allows the client to see their own answers in their own time.
Yeah.
And it'll come to them through insight, not through analytical thinking. So we don't know when that moment of insight will arrive, but we know that that's the way we learned to walk. That's the way we learned to ride a bike. That is the way that human beings learn best. And it's lifelong learning when we learn through insight. We're just finally now able to give it credit that it deserves. And that's what insight is. The goal of all coaching is insight. It is also the outcome.
Yes, yes. So I'm guessing that nurse entrepreneurs who are struggling to put their offers out to their audience and their customers, feeling shy or embarrassed, they could use the resilience principles to gain insight into what it is inside themselves that is tripping them up.
I love it. We actually named our first course Essentials, the second course Understanding, and the third course, which is Sharing, is is coaching, how to learn to coach. So we focus our first 2 courses on the nurse herself first, understanding ourselves. When we know how we work, we know how everyone else works.
Hmm.
Share that.
Hmm. Because the principles are universal. Is that right?
Absolutely universal. Absolutely universal. This is where Dr. William James started in 1890. He wrote a book called The Principles of Psychology. His colleagues read it and they said, well, where are the principles? And he said, well, they haven't been revealed yet. And even within our own profession, Dr. Helen Erickson wrote in 1982 that the principles of health had not yet been revealed. Well, now the principles have been revealed, and that's what we're sharing and teaching and coaching.
And can you remind me, Lyn, who has done this seminal work to reveal these principles? I know everyone that's using them is working on them in real time. Also, there's someone that began to articulate those. Would you?
Right. He was a very wonderful, common man who had an experience of enlightenment in the year 1977. And he tried to articulate that and share it. He spoke to psychologists, he spoke to colleges, he spoke to the Massachusetts Institute of Technology. They invited him back 3 times. He said, I can explain how the world works, but you'll have to do the math. And his name is Sydney Banks.
Sydney Banks, that's right, sure.
What I love about his work is he never claimed it as his. He said, I'm just trying to explain it, but it's not in the words. It's beyond the words. It's not, I don't own it. You don't own it, but we all use it. And I really think that speaks a lot to the kind of man that he was and the body of work that he's left for us.
Mm-hmm.
That how does new knowledge get here? Really, honestly, how does it get here? It can come through the checker in the checkout lane. It can come from a baby. It's that kind of knowledge that we know, and someone came along and put words to it.
Mm-hmm.
And that's what we're doing with our school, is teaching those words so that other people can hear it too. And it's in the simplicity of it. It's the simplest thing I've ever done.
Mm.
And it's not even a doing. It's kind of like it's a noticing or a recognition that really allows change to happen.
And it's a series of insights that build on each other, wouldn't you say? That's
Well,
my
yes,
way of
it is,
looking at it.
because every time we have an insight, our ego collapses on that subject. Well, there's trillions of those, but enough of them collapse, and pretty soon big pieces drop off. I had an insight one day that I couldn't wait. I told Lyn all about it. I was so excited. And then she asked me to share it in class. I couldn't remember it. It's like it was absolutely, completely healed and gone. And I still don't know what it was. And so it's like, that's really weird, and to think that certain ways that I've believed my entire life are no longer part of my experience.
Yeah.
What would that do for humanity if we could help people do that?
The illogic is falling away as
Mhm.
logic reveals itself to us. And isn't it interesting that the leading edge of our profession today is coming through continuing education rather than through academia? Nurse coaching.
Yeah. Well, continuing ed is blessed in that it's smaller and less embedded in structure than academia. And so it can change and morph and evolve more quickly. But then academia can learn from that, from what we're doing in CE,
Yeah.
and be then have what it needs to grow and evolve too.
And they are. We're teaching at the university level at a DNP and NP program also. They're sending their students to our program to learn.
Wonderful. I'm really glad to hear that. Well, this has been great, Lynn and Teresa. I really appreciate all that you've shared today. And I'd like for you to tell us how people can get more information about Advancing Nurse Coaching, the educational program. Would one of you share that?
Okay. Yeah, we have an 80-hour continuing education program, and you can sit for national board certification after those 80 continuing education hours plus 60 hours of coaching. And our website is so easy to remember. It's the best way to get in touch with us, nursecoaching.com.
Perfect. Perfect. And I understand that you have a free gift that you'd like to share with the listeners.
Yeah, we have a little PDF that tells the story of the principals at work and a little bit about what they do for us. And it's called Dancing in the Moment, What the Resilience Principles Do for Us. And we'd love for you to read it. It has a little bit of information on it about the approach that we take and the implications of 7 implications, 3 principles, 1 paradigm that create human experience, that allow us to see it. And very simple, just kind of a little info sheet to let you know a little bit more about it.
Wonderful. So listeners, you can get that PDF that Teresa just described by clicking on the button below this video. Just click that and you'll be taken to their website and where you can download the gift. So would either of you like to share any last thoughts with the audience?
Well, just do it today. We're only going to be having this special event for about a week, and there is no time like the present. So be good to yourself. Take the most beneficial step towards self-care by enjoying learning about resilience principles. Thanks so much, Sharon.
Oh,
Thank you.
thank you both for being here. I really have enjoyed it. And thank you to the audience for being here today. You've been listening to Sharon Birch, Lyn McCright, and Teresa Walding for the Respectful Marketing Tips for Caring Nurse Entrepreneurs event. And as Lynn said, remember to watch the interviews this week. They're only available through Sunday, September 18th, and then they come down. And that also includes getting the gifts that all the speakers are so generously offering. So jump right in, be good to yourself, keep learning, and we look forward to connecting with you down the road. We hope we are stay connected with all of you.
Yeah, thank you, Sharon, so much for doing this for nurses. This is just the time when this is needed, and you're here for us now. Thank you.
Yeah, thank you so much.
You're welcome. Thank you. Have a great day, everybody.
Thanks.